And thank you for joining us this Friday for our final press briefing of the week. Today, Orange County Mayor Jerry L. Demings will discuss Orange County's effort in assisting the state with the vaccination process. The mayor will also give an update on COVID-19 cases, positivity rates, and more. From the Florida Department of Health here in Orange County, Dr. Raul Pino is here with important updates also on the vaccination process, as well as COVID-19 trending in our area. Mayor Buddy Dyer could not be with us this afternoon, but we do have here with us Orange County Public Safety Director Danny Banks, who will give you an indication of the work being done by our county teams in conjunction with the state. We begin our press conference with Mayor Demings. Mayor?
Thank you, Dr. Williamson. Thank you to all of you. As we come to nearly the end of another week, it has been quite an eventful week for all of us. Today represents the 302nd day that we have been under a state of emergency here within Orange County. When we started this 302 days ago, we didn't think we would be under a state of emergency that long. But the way things are looking, there's no question in my mind we will likely reach 365 days at some point in the near future. Over that period of time, we've really worked diligently to serve the people here in Orange County, and I want to make sure that I thank our Orange County employees who have really been rising to the occasion to take on additional roles and responsibilities as public servants. And so I give special recognition, however, to our Health Services Department workers, the Orange County Fire Rescue Department. Many of the paramedics and others in that department have been working to help fight this public health crisis that we are within. Our Orange County Information Systems and Services employees, they've done a yeoman's job as we have had to manage our website, the various portal openings, testing and vaccinations. We have served hundreds of thousands of people during that period of time over the last 10 months. So let me just say again, thank you really on behalf of all of our citizens to our employees who've had to roll up their sleeves. It has been a good week for vaccinations here within our community. We had a little confusion, however, about who's managing the scheduling of appointments for vaccinations. I want to try to make certain that we're clear to you that the Orange County Convention Center vaccination site and the online registration process is not a process that Orange County government manages. It actually is a process that is managed through the state health department and not Orange County. However, we are a partner with the state in that effort. We have received numerous correspondences through social media and otherwise about the registration process, and we are just helping to facilitate that process to better serve our citizens here within the county. Our Public Safety Director, Mr. Danny Banks, is here and will give some details in just a few moments about the tireless efforts of county employees who have been working through the process to assist the Department of Health in registering and scheduling the appointments for individuals. And at this point, let me just talk a little bit about the vaccination process and share some information with you. Healthcare workers at the Orange County Convention Center vaccination site continue to run a smooth operation, getting shots into the arms of those who need it. So once you register and you make your appointment, I know it can be a little dicey getting an appointment, but once you actually get out to the site and you go through the process, it's a very smooth process at that point. Yesterday, they administered 1,858 doses of the vaccine to individuals. The total number of Orange County residents who have received their shots as of this morning is 35,403, which is approximately 2.9% of our county population. So to get up to the 75 to 79% of our population, we still have a long way to go, but we have gotten 2.9% of our population vaccinated at this point. So we're saying to all of our residents, Please be patient with the process. We're somewhat at the mercy of the state of Florida and the number of doses that the state receives. The governor and the state controls the distribution of any of the vaccine coming into our state, which really is a function of the availability made possible through the federal government. So here at the county level, our job is to, once we receive the vaccine, make certain that we efficiently get it into the arms of real people at that point. The total number, again, of Orange County residents who have received their shots as of this morning is 35,403. Dr. Pino will have more details, but he has shared with me a bit of good news that 20,000 doses of Moderna and 20,000 doses of Pfizer vaccines have been requested from the state and will likely be sent for our use next week. So the combination is 40,000 doses that we should receive next week here within this community. I want to remind everyone that there is help available to those residents who are unsure how to register online. We have trained personnel at 4 of our Orange County community centers to help register seniors to get the vaccine. The website for making appointments, again, is managed by the State Department of Health, but at our community centers, our staff is there to help facilitate them getting online to make any registrations. Those 4 centers are Holden Heights, Pine Hills, East Orange, and the Taft Community Centers. County staff will be on hand to help seniors with assessing the registration site. Again, this is for people who don't have the technology at home and they need assistance through that process. I will tell all of you that the demand for the vaccine far exceeds the availability of the vaccine that we have here within our community. So if the state, as the state gets more, we will get more, and we have plans and a process to quickly inoculate people here within our community. I will tell you that our centers that are providing the assistance, they are open 8 a.m. to 4:30 p.m. Monday through Friday each week. You can get information about our centers by going to our website at ocfl.net/community centers, and you can find a location that is nearest to you. Since the pandemic began, there have been a total of 84,854 cases reported in Orange County. Now, I want you to put that number into perspective. On December the 30th, we had 75,317 cases. So roughly 10 days ago, we had 75,300 cases. We now have 84,854 cases. That means that over that 10-day period of time, we have averaged about 10,000 new cases a day. Quite frankly, that means the numbers are not going in the right direction for us. There were 1,427 new cases reported just yesterday. That is a single new day record for cases within Orange County. That is a record which greatly concerns me because that means that the virus is continuing to spread, and it's spreading in our community relatively rapidly. So we must continue to wear our masks, socially distance, and when we can, sign up to get vaccinated. The 14-day rolling positivity rate is now 13.2%. And you've heard us say before, when we are under that 10% mark, we believe that we have done a better job of successfully containing the virus. So now that we're over double digits at this point, or into double digits, that is concerning to me. A reported 777 Orange County residents have died as a result of the coronavirus. That is an increase of 1 death since our last briefing a couple of days ago. So Now, we are fortunate, however, to be able to continue to offer free COVID-19 testing Saturday and Sunday this week at Barnett Park. Tomorrow and Sunday, we will continue to offer free testing. Our Orange County Health Services site is open there from 9 a.m. to 5 p.m. 7 days a week, and we plan to be there through January the 30th. The site offers both the PCR molecular and the rapid test. For information about testing, you can go to our website at ocfl.net/testing. And also, now let's talk a little bit about our compliance teams. Our effort to try to contain the numbers means that we have to hold businesses and others accountable. And we have been conducting inspections for 124 days, going back to August at this point, by using these compliance teams to go into businesses. The teams have visited over 6,200 locations with a compliance rate. 99% of the businesses that they visit are in compliance. We still do get complaints, and since the executive order was issued in December, the compliance teams have visited 855 businesses just since the executive order went into effect. They have issued 69 warnings and 12 citations. Now, here's a warning about this weekend. The strike teams will be out this weekend making unannounced visits to businesses throughout Orange County to make sure that we continue to comply with the facial covering executive order and the social distancing. On a positive note, I would like to give an update on Orange County's CARES Act program for individuals and families. We have provided $65 million in assistance to our residents. The application portal for the program is closed and will not open again unless we receive additional federal stimulus dollars. Again, I'd like to thank our residents for being patient with us as we have administered these various programs over the many months. And one last thing I'll touch on today, our Citizen Safety Task Force recently launched a crime survey to gain insight from residents on solutions and strategies to prevent and reduce gun violence and violent crime. We're asking our residents to please assist us in filling out the short survey by going to our website at ocfl.net/crime survey. More than 1,200 residents have taken the survey at this point, and we look forward to increasing that number before we close the survey portal at the end of January. For more information about our Citizens Safety Task Force, you can go to ocfl.net/safety task force. And now Dr. Raul Pino, he has an abundance of information to share with you as well. Dr. Pino.
Good afternoon, everyone. The mayor shared with you the news about testing, so I'm going to concentrate for today on vaccines because there's a lot of questions. So first, we are aware there has been some challenges with the site to a degree that is normal due to the demand that we are having. So just to give you an idea, when we first opened, 40,000 people registered in 24 hours. Right now, we have 59,000 appointments already scheduled. We are solely booked until the 20th. Yesterday, the mayor really was pushing us to increase the number. Yesterday, we opened another 500 additional slots in our schedule per day. It got filled immediately. Yesterday, we filled 400. And we opened at 8 o'clock in the morning, the site, and it was down for a while. And even with that, 400 people registered. So people are registering. We will get to you. What we cannot do is get to all of you at the same time. That's humanly impossible for us right now. So this is This is what we are planning to do and what we are doing. So at the site, as the mayor mentioned to you, we have done over 11,000 vaccinations since we started at the convention center. We are doing 2,000 a day. We have a team of about 160 individuals each day. We have it in two shifts from 8 o'clock in the morning, the opening. The hours are a little bit longer for the staff, but the openings of the place, the appointments are from 8 o'clock in the morning. The last appointment is at 9 o'clock at night. So a few suggestions with that. So first, be sure that you have this QR code before you come to the appointment. All your information is here, so we really, really need it. Because this is what really is speeding up the process. Because all the data, all your data is in there. The only thing that we have to do is to corroborate the data. The other announcements that we want to is that we have also engaged in mobile pads. We are now visiting, right now we have done 300 of those. Of course, that's a little slower because it's another dynamic, but with the help of EMS services in the county, we are starting to visit buildings and structure for congregated housing for seniors over 65 years old that either are in socioeconomically depressed areas or people who are having challenging accessing transportation to get to the convention center because the convention center is only a drive-through. So we please ask you not to come in motorcycles or bicycles and come in vehicles because the site is designed for vehicles. And it's a lot of moving pieces and a lot of moving vehicles, and we want everyone to be safe, especially our staff that are unprotected, and it's a tight space where we have, over 2,000 cars moving a day. So if you haven't seen it, I will advise you to look for those videos online. It's quite interesting, the site. So what happened yesterday around noontime is that because of the high traffic and because of people from outside of the state were trying to access the site, the internet providers have safety measures in place that this indicates, okay, is this real or this is a attack, a cyber attack? So that really kind of activated safety measures that the providers, internet providers have to protect their, the internet. So that's what activated those blocks that we saw. Now, that didn't compromise what we were to do yesterday. We did our appointments yesterday. We have new 400 people registered. So what have to happen, and did happen, is that with the help of the County Information and Technological Services and the contractor that is handling the website, the internet providers were one by one communicated, this is the site, this is the type of traffic that we're expecting, it's not an attack. So that in future events that we see an increase of traffic, this doesn't happen again. So we are by crew numbers, total numbers, the third highest vaccinated county in the state, beyond Miami and Broward County. And we are catching up very fast, so we could be second very fast. We also are planning to expand using EMS providers across all municipalities in our county progressively. As we training in our system how we do it, and as we increase our inventory of vaccines, you are going to see many EMS municipalities involving in their own citizens, their own residents, and their own facilities that they know better than anyone, because those are the ones that they do a lot of transportation from and for. So it's critical that we get EMS involved and very involved. We're also working in what we call closed pads. So we are working right now with UCF. That's one that we are working on it. And the idea is to have a closed pad. Now, when we do those closed pads, be assured that those closed pads will respect the guidelines from the state. Meaning, if we do a closed pad at UCF right now, it will be only for people who are 65 years and older. If we do a closed pad with the school system, what we will try to do, it will be 65 years and older. No one is going to get priorities that they don't have. I just want to assure the population of that happening. So with that, please be patient. We will get to you. We are going to increase volume. The availability of vaccines is rapidly increasing, and the state has assured us that if we can move vaccines, they will continue to send to us. So as long as the state has supplies and as long as we are moving vaccines, we will continue to get. Now, another thing that I want to instruct the public is that it doesn't matter, but I want you to know that at some point tomorrow or maybe Monday, we are switching to Pfizer because we are running out of Moderna for the first 16,000 that we got. But we got plenty of Pfizer. We have 19,500 other dosage of Pfizer in storage with the county, and thank you for the county for being so visionary and acquiring that technology, because that's what has been providing us the ability to retain more storage capacity for vaccines. With that, we also want to remind everyone, your appointments, please do not shop. Your appointment is from, let's say, 7 o'clock, 8 o'clock in the morning to 9 o'clock. Everyone is showing at 9 o'clock. And that's fine, but knows that if you show at 9 o'clock, you may have to wait a little bit longer with your appointment. So try to space it out a little bit if you can, so that you don't have to wait that long. Now, the wait is not that long anymore. The first day, our waiting time was about 2 hours. Recently has been as low as 45 minutes. And also as the highest that we are getting is an hour and 15 minutes. And that's around 10 o'clock in the morning. It gets heavy, then it goes low around 7 o'clock at night. With that, I will answer any questions that you may have. And to the public, again, we will get to you. We are going to expand progressively, and we are here to serve you. So we are committed to provide this vaccination to all of you. Thank you.
One more, and then we'll go to questions right after.
So now I pass it to Director Banks.
Thank you, Dr. Pino. And I wanted to come today at the request of Mayor Demings and provide you an update on exactly what our Orange County Public Safety staff are doing in supporting the Department of Health's vaccination initiative, particularly out at the Convention Center. We've had a great collaborative relationship with the Department of Health really over the past months, but particularly in the past 2 weeks. We're providing extensive resources to the site at the Convention Center. Each day, our fire rescue department and our health services departments have dozens of paramedics and nurses involved in the vaccination of our residents. In addition, our fire chief, James Fitzgerald, has personally visited the vaccination site each day and worked directly with Dr. Pino and his staff, providing logistical support as necessary to make their site a success. Along those lines, and as Dr. Pino mentioned, you're familiar with the fact that Orange County made an early investment in the extreme low cold freezers, which have now come into play in Orange County. As Dr. Pino mentioned, we've been able to support the Department of Health by providing storage for the 19,500 Pfizer vaccines that we received in Orange County a few days ago. And we'll continue to extend this resource to ensure we have the ability to store any amount of vaccine that the state is able to send to us in Orange County. And lastly, along with having a supply of vaccine, we must create multiple opportunities to disperse it into the community. We cannot rely solely on a drive-through site to serve all of our community's needs. And in that regard, again, as Dr. Pino mentioned, today we're really happy to announce that beginning Monday, there'll be teams of our Orange County firefighters that will begin visiting some of our senior living facilities in the county to give them the opportunity to be vaccinated. There are dozens of these communities and senior living facilities in our county who are in need of our assistance. We're happy to provide the support and serve as an extension to the Department of Health to serve those in need right now. Within the week, our paramedics will be vaccinating residents of those communities, and we'll be working with each of our municipalities over the week to expand the number of those deployment teams over the next week. So with that, Mayor Demings, I'll turn it back over to you.
All right, thank you, Director Banks. I want to go back and clarify something if I said anything that wasn't quite right. Since December the 30th, that's 10 days ago, we had about 75,000 cases, and so today with the numbers we reported, we had about 10,000 cases, new cases in that 10-day period of time, which the average is about 1,000 new cases a day, not 10,000. If I said 10,000, that would be way too many cases, but even at 1,000 new cases a day, that's still concerning to me in our community. So with that, I'm going to open it up for any questions at this time. So let's see. There is our mic. We have Lauren back. So let's see.
back.
Dr. Pino, she has a question.
Actually, my question is for both of you, Dr. Pino and Mayor Demings. It's kind of a two-parter here, but I want to talk about the numbers because, as you just mentioned, we're averaging around 1,000 a day. Back during the peak, when we were averaging, around that, and our statewide numbers were much lower than what our statewide numbers are now. We were talking about closures and things like that. Obviously, I know your hands are tied because of the governor's order, but I'm curious, one, if Dr. Pino, you can tell us where that spread is happening in the community. And then, Mayor, when you talk about the strike team seeing 99% compliance, do you have any tools left in the box to be able to really do something about these numbers, or are we just going to continue to see them climb and climb and climb until we have mass vaccinations?
So although you call it closures, I would call it pauses. Although those are tools that were used in the past, the difference between now and what happened in the summer, and prior to that, late spring, early summer, the transmission is a little bit different now because the cause of transmission right now is people not adhering to CDC guidelines. It's happening in small clusters. So in the past, we saw factories and farms and large operations having large outbreaks. We saw a few outbreaks at the airport and a mattress facility and a few in Apaka and other places. But now we are not seeing those massive outbreaks. What we are seeing is more in-house, family-related transmission, or people that you know. It's not much that a stranger. It's not that we don't have the mask. It's not that we don't have the mask mandated or this hand sanitizer or the advertisement to keep people away from each other. Everything is in place. But right now it has been a group of people that are not respecting the guidance. And now what you are also seeing, and we haven't seen the end of it, is the overlapping effect of so many holidays and the travel that happens with the holidays. So our numbers could go as high as, it could reach 2,000 cases a day in a couple of weeks. Now, so an interesting phenomenon that has happening, and we encourage people to please adhere to CDC guidelines, is that the hospitalizations have increased exponentially, progressively. It was very slow at the beginning. Now it's taking really a hike. But we have seen in the last couple of days, although that's not a trend yet, we have seen it's stabilizing a little bit. So we're watching the data for some hopes that this will not overwhelm our healthcare systems. And that's a huge concern that we have always expressed. And for people, not because we are vaccinating, this is over. It will take a long time to get what we need to get. Only, the mayor just said it, about 2.9% of our population has been vaccinated, and herd immunity for this particular disease is about 79%. So we are a long way from that.
I guess the only thing that I would add, Dr. Pino did a wonderful job of summing it up, but I think the other distinct difference between now and when we were at our peak before is the fact that we do have the vaccine that's available. And so for us, it's absolutely critical that as the supply of the vaccine increases, that we work to efficiently get people vaccinated. So Director Banks was speaking to the plan that we have. We have an excellent plan. We can exponentially increase the number of people who would be vaccinated within our community if we had more vaccine. So that's the only thing that's limiting us now. Now, what we are being told from the federal government and from the state is that the supply of the vaccine will increase in terms of the flow. It will increase into our community. So we're prepared. We have done all of those things necessary to do that. So there's no question if we're at 2.9% of our population, every day that percentage will increase over time. And our goal is to, as quickly as possible, get up to the 79% referenced by Dr. Pino. During the process, in the interim period of time, I should say, we are going to continue to hold businesses accountable. We're going to continue to come and say to our community, do your part. Your part is real simple. Wear the mask, socially distance, and do those things until we can get our population inoculated. So, okay, thank you. All right, where are we now?
Eric, yeah, hey, how's it going? Eric Mock, Spectrum News 13. Question for Dr. Pino and maybe Mayor Demings as well, depending on what you think you should respond. Now, like you said, you're already seeing 59,000 appointments booked. You're booked till the 20th, and the system, like you said, had problems because of the massive, massive demand. This is just people 65 plus. What's going to happen when you start opening this up to? I mean, can we really realistically expect that the state health department's website and everything else can handle that kind of demand if we can't even handle just the 65 plus people right now?
Yeah, but you know, 65 people, over 65 people in Orange County is more than 200,000 people. So that's a very large volume. We are not a small place. Listen, I don't think that any website for booking appointments can handle 260,000 people trying to access this site. Now, we are taking steps to do that. So we are acquiring other technology. We are in the process of acquiring other technology. And we are not using the same strategy of these type of a strategy is for this type of approach, meaning the drive-through vaccination site. Or the other places that we are visiting, the registration is done there in person. So it's a little bit different. And what the EMS services providers and the fire department are going to do in this case is they are going to visit places 2 days in advance of the real appointment so that we can acquire the information, fill out the forms, and get everyone ready. So each approach is going to be a little different. Again, this appointment site is designed for this particular situation that we have in the drive-through environment. Now, it could be that if we get sufficient vaccine available, then we could potentially, with the support of the county, open another drive-through site. But we have to wait to see how that's feasible. So the way that we are doing things, so our population understand, we perfect an approach and we move and scale up. We take another approach, we perfect that approach and move and scale up. I think the mayor was referring to offering vaccine efficiently. It's also important in this process to be sure that we are taking the right approach and that we are doing it right. You have not seen here, fortunately for us, unfortunately for other sides, what had happened around the country in other sides. So I have to say this, without the support from the county, we will have not been able to do this.
The only thing that I will add in terms of the demand, it's not just the residents of Orange County that can make appointments to get the vaccine in Orange County. Any residents, you can be anywhere and also apply for an appointment. That's by order of the state. That's the process we're dealing with. So not only in terms of the competition for the limited number of appointments that's available, that universe is larger than what just lives here as well. And so is that the right thing that should have been done? I don't know. I didn't make the decision, but we are trying to manage the expectations of our residents here within our county. And eventually, I believe that we will see a widespread availability of the vaccine throughout America, throughout the state. And once that happens, hopefully we have a better ability to manage expectations, I think, at that point. And so I believe you are absolutely right. The good news is people want to get the vaccine. Bad news is there's not enough available vaccine today to vaccinate everybody that wants it. And so we have to establish these priorities going forward. So perhaps in the next few months, we're going to learn from these processes. We have a learning curve. We're getting much more efficient at handling the demand. Okay, where's the mic now? Okay, there we are.
Hi there, Lara Greenberg, Fox 35. This is for Dr. Pino. About how much of the 65 plus population have we vaccinated so far? And then based on that, how long do you expect it to get through that entire population? And then this is going to come from the state, and I recognize that, but I wonder if you have any indication of who's the next group after 65 plus that would be prioritized for vaccinations.
Let me take the last question first. I don't know who the next group is going to be because the governor have the ability to modify CDC guidelines. So as you said, that's a question for the state. I work for the state, but I'm not the state, so it's a little bit different. So with regard to the age groups, I don't have it yet, but with regard to the length, it will depend how many sites we stand up. You are going to see announcement and news of other systems in Orange County that will be incorporating mass vaccinations approaches. So more is coming. And we are not the only recipients of vaccines in the county. There is also the hospital system have received vaccines. Community health centers are receiving vaccines for the employees and healthcare workers. And it will increase. And remember, 2 weeks ago, we have none. Right now, we have 40,000. We have 20,000 in hand. We did 16,000. We have another 40,000 coming. It will flow. It will flow. And another funny story to what the mayor said earlier, we got a call from Michigan today. Someone who's going to be here when they have the second dosage, and they were asking if they could have it. So it's happening, and to a degree it's suspected as we are a hub of everything. You know, whatever happens in the world happens in Orlando. And that will happen. We will encounter residents, non-residents of the county that are receiving vaccination here. And why is that? That is because the program is supported with federal funds. So that has to open to the entire country. That's the reasoning that we have gotten from the state. Initially, we restricted to county residents, but we were quickly reminded that it has to be open to anyone that want to have access. And that increase traffic to the sites, of course.
This is Melissa Thomas of Florida National News. This question is for Dr. Pino. Obviously, as Mayor Demings mentioned, that, you know, Orange County is kind of partnered with the state to administer the vaccine, so the state is probably getting more of the information. But I was just curious, have you guys heard any feedback from those who have been vaccinated, if there are any allergic reactions or any kind of adverse reactions to the vaccine so far? Do you guys get that feedback, or does that stay with the state?
No, we get the feedback. So people have the ability to enter adverse reactions in the website, and many people have done that. We haven't had any major, so we haven't had any anaphylactic shocks or any of that nature. Most reactions that we have in the county this far has been, some people expressed dizziness, pain in the site of the injection. Some others have reported redness in the area. And today we have a little bit of a person that overreacted, but it seems like it was not related to the vaccine. It was not an anaphylactic shock. And some people are very impressionable by getting through the vaccine. And we also are vaccinating some individuals who are over 90 years old. So there are other conditions that may play a role, but we haven't had any major adverse reactions.
Question for Dr. Pino.
I'll add to what Dr. Pino says in terms of reactions. I gained about 2 to 3 pounds over the holiday, and I'm going to blame it on the fact that I got that vaccine here. I wouldn't have gained that weight. Anyway, we're old. That's what I'm blaming it on.
So over here, question for Dr. Pino for Telemundo. Dr. Pino, un resumen de lo que dijo en inglés sobre las vacunas, cómo está el panorama, y si ya están booked o los registrados hasta el 20, ¿cuándo se volvería a abrir para las personas que quieren vacunarse? Y ese resumen, por favor, en español. Thank you.
Sí, el sitio está abierto. Y la cuestión interesante que la gente no ha... Cuando vamos a enfrentar, ¿cómo se dice challenges en español? Retos. Vamos a enfrentar retos. Es cuando tengamos la primera y la segunda dosis al mismo tiempo. Entonces, lo que yo había dicho inicialmente en inglés es que todas las personas que vengan al sitio tienen que tener este código, este tipo de código, porque, creámoslo o no, aquí está toda la información de la persona. Y es lo que nos facilita a nosotros y nos da la habilidad de movernos rápido, de mover el número de personas rápido. Entonces es importante también que la gente venga, que no todo el mundo se apresure a llegar a las 8 de la mañana si tienen la cita a las 8. La cita es de 8 a 9. Solo le pedimos a la gente que se distribuya un poquito más en el tiempo. No se apuren en llegar a las 9. Si llegan a las 9:30 es válido. Si llegan a las 10 es válido. Y estamos haciendo 2,000 vacunaciones al día aproximadamente. Tenemos 2,000 citas al día. Entonces, eso es básicamente lo que dije en inglés. Pero, I wanted to add a little thing that I added in Spanish that I didn't say in English before, and is that the real challenge is going to be when we have overlapping dates of first dosage and second dosage. And that's going to be a little bit of a challenge. That's why we are moving so fast and rapidly in getting all their sites open, in getting all the providers providing those vaccines to have a multiplier effect. Another thing that is important for the public to understand is although your vaccine, we always say Pfizer is 21 and Moderna is 28 days, there is 3 days, 72-hour grace period prior to the 21 and the same for the 28 days. There is no limit how far between the first and the second dosage you have to wait. You can wait more than 28 days. You can wait 30 days. So what I'm trying to say to people who are going to get very compulsive about being there on the 28th, if your appointment is beyond the 28th day, it's absolutely fine. And it could be the case that due to demands, your appointment is not going to be exactly on the 28th day. It could be the 29th, it could be the 30th, it could be the 35th day. That is absolutely fine.
Kelsey Thord with West 2 News. I have a couple questions for Dr. Pino. Number one, what other site are you guys looking at for a mass vaccination site here in Orange County? Also, you talked about you're now getting 40,000 doses next week expected. Just, can you give me a timeline of so far of the doses that you've gotten? How quickly do you go through those doses that you already get? Say, your first 16,000, are you already through those? Are you still using those? And then finally, I know it's a lot, the Biden administration announced today that they're really going to push to get out all of the federal doses. Right now they're reserving about half of the doses they have to make sure that people have that second dose in a month when they're supposed to get it. But they say they're planning on just when he comes into office of just releasing all of those doses. So that means that we could potentially see a flood of a lot more doses here in Orange County. So what's your guys' plan for that? And then do you think that's a good idea? Because there's a lot of issues whether or not that potentially could complicate people getting that second dose in a timely manner.
So that's a good question. I haven't seen the announcement. I've been at the site. So in my professional opinion, and this is personal professional opinion, what is critical in a pandemic environment is to offer that first dosage to as many people as possible to get some level of immunity. That's my personal professional opinion. Although there has been some suggestion to do that, other people are saying no. I think that having a second dosage is going to limit our capacity to continue to increase the first dosage unless we get that large volume coming in. Now, if that large volume was to coming in, what we will do is activate multiple close pads like we are doing with UCF. So, for example, UCF, we are working with them to do 65 years and older. But when the criteria open up, they can do anyone. And they have thousands and thousands of people, students and workers and other contractors that they have in place. So that's how we are going to multiply. That's why we are training paramedics in how to provide these injections, because that will be multiplying. And then you have all the healthcare centers and all the health systems. Now the hospitals have been asked not to only vaccinate their employees, but also to vaccinate other healthcare workers that are not affiliated with the hospital, independent practices, community health centers, community health workers. So you are going to see very soon a rapid increase of the ability to provide those vaccines. Now, again, all is going to be depending on the supply.
And then with just the timeline of how quickly?
Yes. So the 16,000 are going to be over probably tomorrow. We have right now more than 11,000 vaccinated. We are doing 2,000 a day. If we do 2,000 today and 2,000 tomorrow, that's bringing us very close. We will always leave a reserve, a little reserve for the Moderna in case that we need to access, because what Moderna offered us is flexibility because of the temperature control, so we can take it anywhere. So that offers that flexibility. With regard to the Pfizer that is in the county's storage facility, those are 19,500. We could do those in 10 days. But again, we are expecting about 40,000 next week that we have requested.
And then what would the next mass vaccination site be?
I think that what you are going to see next from us is probably engaging with UCF, with a specific institutions like the school system to do close pads. And I think that hospital systems are also planning to open up to the community when they get enough supply. So there are going to be multiple pads.
Just ask, you had said there was a drive-through, you were thinking about doing a second drive-through, where would that be?
We have many identified locations. For example, one of the UCF and Malaysian parking lots are part of our design. The same place that we the flu shot on the promenade on Colonial. So if the health department with the county opens another pod drive-through, we will try to open in a location quite far from the center and maybe on the east side of the town.
Nikki Zizazo with News 6. My question is for Dr. Pino. Dr. Pino, around Christmas time, you had, already said you anticipate that if people do not comply, we could see an increase, and that's obviously what we're seeing day to day. A lot of people, even some other neighboring county health leaders, have said that we may not, really realize the effects of the vaccine till 7 to 8 months. So with the spike we are seeing in Orange County and pretty much across the state, what is your estimate in terms of when we are going to see things hopefully kind of turn around with how quickly you guys are vaccinating, but at the same time really trying to tackle this spike in cases?
All depends on what strategies the new administration may use in their plans. And I don't know anything about it, but they have said that they have different plans. So that could be a little bit different. I will say that we should not see major changes before the summer. not until after the summer.
This next question is texted in from Troy Campbell. This is for you, Dr. Pino. With only 2% of Florida having received their first dose of the COVID-19 vaccine, how many months are we realistically looking at until we reach a herd immunity percentage that will impact or decrease new case numbers in Florida?
That's a very difficult question to answer in the sense that it all depends how quickly we can give vaccines and how quickly we can get vaccines. Florida, I believe, has the second largest number of vaccinated individuals in the nation, but we also a very large state. We have more than 22 million residents. So that's a significant number. And it's very difficult to predict or project when this is going to happen because the rates are going to change.
With today's numbers coming out and setting a new daily record, Steve Hudak's question here reads, Dr. Pino, with those kinds of increases, how dangerous is our situation right now?
Well, I think that we will have to define dangers. Our situation is better than we were in the summer. As the mayor mentioned, now we have a vaccine. We are quickly moving through the process. I think that after this peak, we are going to see a quickly decline due to people adherence to the CDC guidelines. The fact that we don't have any major holidays coming up that people will travel, and also the work that the strike teams are doing with assessing business accountability with regard to the measures that the CDC has put in place. So we probably could start seeing a decline, a significant decline, and going back to our baseline numbers probably by the second week of February.
Thank you. This next one's from Nassim Miller at the Orlando Sentinel. Dr. Pino, according to the CDC, Florida has had 22 cases of the new COVID variant. Do you know which counties have reported the cases? How about Orange, Osceola, Seminole, or Lake?
I'm not well informed. I know that we have it. I haven't been informed that we have in Orange County. And the other places, I do not know where they are.
And just to be clear, you said we don't have it in Orange County.
Not that I know. But again, let me explain this clearly. That variant of the virus can be anywhere in the world. That was a retrospective study. So when it was detected, it has been weeks and weeks after the modification happened. So it could be here, it could be anywhere.
Is there anything that you are doing at the local level to identify this new strain?
No.
Lastly, from Ryan Lynch with the Orlando Business Journal, Dr. Pino, how does the pace of vaccinations now compare to what you expected prior to beginning this process?
So that's an interesting question. I didn't have any expectations of what the volume will be. I had nightmares. Real nightmares. I'm waking up at 4 o'clock in the morning during the planning phase because I was very concerned about anything going wrong. And although we have some hiccups, which was expected, and that's why we increased the numbers gradually, we have not had any major significant issues that are preventing us from delivering the volumes that we are scheduled to deliver. And that has been thanks to the support from the county. I know I have said it quite a few times, but it's true. Not everyone is having the same experience. And the issue here is not, when Orlando made news, it makes international news. And I was really, really concerned that something could go wrong and we will be in the front page of the Wall Street Journal or the New York Times. And all the efforts that we have taken, everyone that has sacrificed time and sweat and energy, we have been discredited by just a bad news. And with that, that pleased me.
Thank you.
You know, as I listen to all of this and I listen to the questions, one thing that I think is somewhat unique in our county is the fact that we do have these compliance teams. The virus is not contained within the boundaries of one county. It moves around. But just think about it if the other counties throughout the state had the same kind of compliance where they were requiring and inspecting businesses and holding others accountable what we could accomplish. Unfortunately, that has not been, we do not have uniformity throughout the state of Florida. And so, Dr. Pino, perhaps in your personal opinion, if we increased the accountability, let's say if we were able to do that statewide by using compliance teams statewide, do you think we will have better outcomes than what we have now?
I think that anything that increase accountability and adherence to CDC guidelines will definitely have an impact on our rates. As the mayor mentioned to you, we are a hub for technology, for healthcare, for travel, and for work. And we probably have, we have 1.4 million people living in the county, but our daily population probably increased by the hundreds of thousands when people come to work, when people come to travel. I mean, last year before the pandemic, we have 75 million visitors. That's a challenge for public health, economic, and anything. So imagine everyone from other surrounding counties who may not have the the same guidelines that our county has in place, coming in and out all the time. So.
Okay, so I think in terms of a statewide strategy, I think that, that's something that I'd love to see in our state, improve the level of compliance as a state. But I'm not the decision maker on behalf of the state. I get to operate here within Orange County and make the decisions here that affect the people here, but we are also affected by all those around us with the comings and goings. So with that, I think that's the last question, right, Despina? Let me just say thank you to all of you for being here. We hope you have a blessed, safe weekend, and we'll see you on Monday? Monday.